If you have been waking up in the middle of the night more often lately, especially to use the bathroom, to catch your breath, or with a vague sense of discomfort in your chest, you may have already dismissed it as part of getting older. But that assumption can be dangerous, because in many older adults, these nighttime awakenings are not just about sleep. They can be early signals that your heart is under strain, and that your body is trying to warn you while you are lying still, when the usual distractions of the day are gone. You may feel fine during the day. You may still walk, eat, and function normally. But at night, when your body shifts into a different state, certain hidden problems begin to surface. And this is where many people miss the warning. I want to explain what is really happening, why your body behaves differently at night, and what specific signs you should never ignore, especially after the age of 60. I'm speaking to you not just as general advice, but from years of working with older patients who thought these symptoms were harmless. I remember one patient in his early 70s. He told me he had started waking up 2 or 3 times a night, sometimes to urinate, sometimes just feeling restless, no pain, no obvious illness. He thought it was normal aging, but when we looked closer, what he was experiencing was early fluid redistribution and subtle heart strain. Within months, that condition progressed into something much more serious, something that could have been managed earlier if those nighttime signs had been understood. This is the part most people never hear. Your body does not always send loud warning signals. Sometimes it whispers, and it does that most clearly at night. So if you have been waking up more frequently or feeling something is not quite right while lying down, stay with me. Because once you understand what is happening inside your body, you will see these signals very differently. And more importantly, you will know exactly what to do next. Most people assume that waking up at night is simply a sleep issue. They blame age, bladder changes, or even stress. And while those can play a role, they are often not the full story, especially after the age of 60. What is actually happening inside your body at night is very different from what happens during the day. When you lie down, gravity no longer pulls blood and fluid toward your legs. Instead, fluid that has been pooling in your lower body throughout the day begins to shift back toward your chest and upper body. This process is called fluid redistribution. Now, in a healthy heart, this shift is handled smoothly. The heart adjusts, pumps efficiently, and keeps circulation stable. But if your heart is even slightly weakened, stiff, or under pressure, this extra fluid becomes a problem. Think of your heart like a pump connected to a system of pipes. During the day, some fluid sits in the lower pipes, your legs. At night, that fluid returns to the central system. If the pump is strong, it handles the load. If it is strained, pressure begins to build. That pressure can affect your lungs, your breathing, and even your kidneys. This is why some people wake up feeling short of breath or needing to sit up to feel relief. Others wake up needing to urinate more frequently because the kidneys are suddenly processing that redistributed fluid. So what feels like a simple sleep disturbance may actually be your heart struggling to manage nighttime circulation. And here is where it becomes serious. Because these early signs often appear long before a diagnosis of heart failure or serious cardiovascular disease. This is your early warning window. But to recognize it, you need to understand the specific patterns your body is showing you. And that is exactly what we will break down next. One of the most common signs people ignore is waking up multiple times at night to urinate. Many older adults assume this is purely a bladder issue or prostate related, and sometimes it is. But in many cases, especially when it starts suddenly or becomes more frequent, it is actually connected to your heart. Here is why. During the day, when fluid accumulates in your legs due to gravity, your kidneys are less active in removing that fluid. But when you lie down at night, that fluid returns to your bloodstream. Your kidneys now see an increase in circulating fluid and begin filtering more aggressively. This leads to increased urine production during the night, a condition called nocturia. But this is not just about the kidneys. It is a sign that your body has been holding onto excess fluid during the day, something that often happens when the heart is not pumping efficiently. So when you wake up 2, 3, or even 4 times a night to urinate, your body may be telling you that your circulation is not balanced. This is the part most people miss. They treat the symptom, reducing fluids before bed, instead of understanding the cause. Now here is what you should do. First, pay attention to patterns. Has your nighttime urination increased recently? Is it happening alongside swelling in your legs or ankles? Second, try elevating your legs for 20-30 minutes in the evening. This helps shift fluid earlier, reducing the nighttime burden on your heart. And third, do not ignore persistent changes. If this pattern continues, it needs proper evaluation. Because what starts as a minor inconvenience at night can become a much more serious issue if left unaddressed. And this leads us to another symptom that often appears alongside it, one that feels even more alarming when it happens. Waking up suddenly with shortness of breath is one of the most important warning signs you should never ignore. Some people describe it as a feeling of not getting enough air. Others say they wake up needing to sit upright or move around to breathe comfortably. This is not just anxiety, and it is not just poor sleep. This can be a sign of fluid backing up into your lungs, something that happens when the heart cannot manage the increased circulation while you are lying flat. This condition is often referred to as paroxysmal nocturnal dyspnea. When you lie down, the returning fluid increases pressure in your blood vessels. If your heart cannot pump efficiently, that pressure pushes fluid into the lungs. Now imagine your lungs like a sponge designed to exchange oxygen. When fluid fills that space, oxygen exchange becomes harder. Your body reacts quickly. It wakes you up. It forces you to sit up, because sitting upright reduces pressure and allows better breathing. This is your body protecting you. But here is where it becomes dangerous. Many people experience this once or twice and dismiss it. They blame a bad dream, indigestion, or room temperature. But if this happens repeatedly, it is a clear signal that your heart is struggling under nighttime conditions. So what should you do? First, do not ignore the pattern. Even occasional episodes matter. Second, notice if you feel better when sitting up or propping yourself with pillows. That is a key sign. And third, seek evaluation early, because this symptom often appears before more serious complications develop. But breathing is not the only thing your body signals at night. There is another subtle but powerful warning sign, one that many people completely overlook. That warning sign is chest discomfort that appears only at night. It may not feel like the classic crushing chest pain people associate with a heart attack. In fact, it is often mild, vague, or easy to ignore. Some describe it as pressure. Others feel tightness, heaviness, or even a burning sensation. Because it is not intense, people often assume it is acid reflux or something they ate. But here is what may actually be happening. At night, when your body is at rest, your heart relies on steady blood flow through the coronary arteries. If those arteries are narrowed, even slightly, the reduced oxygen supply becomes more noticeable. During the day, your body compensates. At night, that compensation weakens. So even minor blockages can begin to show symptoms. Think of it like a road that looks fine during light traffic but starts to clog when conditions change. Your heart muscle needs oxygen continuously. When it does not get enough, it sends signals. Those signals may be subtle, but they are real. Now here is what you should watch for. Does the discomfort appear when you lie down? Does it wake you up? Does it improve when you change position or sit up? These patterns matter. And here is the key action. Do not self-diagnose nighttime chest discomfort as harmless, even if it is mild, because in many cases, this is an early stage of reduced blood flow, something that can progress silently if ignored. And this brings us to another sign that seems unrelated, but is deeply connected. Before we go further, I want to ask you something simple. Have you noticed any change in your sleep over the past few months? Maybe you are waking up more often. Maybe your sleep feels lighter. Or maybe you wake up feeling tired, even after spending enough time in bed. If this sounds familiar, you are not alone. Many people over 60 experience these changes, but very few connect them to their heart. If you have noticed this in yourself or in someone close to you, I want you to pause for a moment and acknowledge it, because awareness is the first step toward prevention. Now let us continue. Another sign that often appears at night is an irregular or unusually strong heartbeat. Some people describe it as pounding. Others feel skipped beats or fluttering sensations. At night, when everything is quiet, these sensations become more noticeable. But they are not just about awareness. They can indicate changes in your heart's electrical system, often triggered or worsened by fluid shifts, oxygen levels, or underlying heart strain. Now here is what matters. If these sensations are new, increasing, or waking you from sleep, they should not be ignored. Because your heart is not only a pump, it is also an electrical system. And when that system becomes unstable, it can affect rhythm, efficiency, and overall function. And this is where the risk begins to escalate. As these nighttime symptoms progress, they can begin to affect your overall stability, especially during the early morning hours. One of the more serious warning signs is waking up feeling dizzy, lightheaded, or unsteady. Some people even experience near fainting when they get out of bed. This can be linked to changes in blood pressure regulation, particularly a condition known as orthostatic hypotension. But in the context of heart strain, it can also signal that your circulation is not adjusting properly between rest and activity. At night, your body operates in a slower, more regulated state. But when you suddenly stand up, your heart and blood vessels must respond quickly. If that response is delayed or weakened, your brain may not receive enough blood flow temporarily. This leads to dizziness. Now imagine this happening in the dark when your balance is already reduced. This is where fall risk increases significantly. And for older adults, falls are not minor events. They can lead to fractures, loss of mobility, and long-term decline. So this symptom is not just about discomfort, it is about safety. Now here is what you should do. Take your time when getting out of bed. Sit first. Allow your body to adjust. Stay hydrated during the day, but monitor patterns at night. And most importantly, do not ignore repeated dizziness, because it may be your body signaling deeper cardiovascular instability. And there is still one more important piece that ties all of this together. One of the most overlooked factors in nighttime heart symptoms is sleep position. Many people sleep flat on their back without realizing how it affects circulation. When you lie completely flat, more fluid returns to your chest and lungs. For a healthy heart, this is manageable. But for a strained heart, it increases pressure and workload. This is why some people feel more comfortable sleeping with multiple pillows or slightly elevated. It is not just preference, it is your body adapting. Now here is the important distinction. If you suddenly need more pillows than before or cannot lie flat without discomfort, that is not random. It is a compensatory behavior. Your body is trying to reduce pressure and improve breathing. So what should you do? Try slightly elevating your upper body using a wedge pillow or adjustable bed. Avoid completely flat sleeping if it causes discomfort, and observe changes carefully, because these adjustments are not just about comfort, they are clues. And when you put all these clues together, a clear picture begins to form. Now let me bring everything together into clear, practical steps you can follow. First, track your symptoms. Notice how often you wake up and why. Is it for urination, breathing, discomfort, or restlessness? Patterns matter more than isolated events. Second, observe your body during the day. Look for swelling in your legs, fatigue, or reduced tolerance for activity. These are connected to what happens at night. Third, adjust your evening routine. Elevate your legs before bed. Avoid heavy meals late at night. Keep your sleep position slightly elevated if needed. Fourth, monitor changes over time. If symptoms are increasing, becoming more frequent, or affecting your sleep quality, that is your signal to act. And finally, seek proper evaluation. This does not mean panic. It means awareness. A simple check of your heart function, blood pressure, and fluid balance can provide clarity. Because the goal is not to wait for a crisis. The goal is to recognize early signals and respond before the condition progresses. And that brings us to the most important part of this conversation. What you have learned today is not meant to create fear. It is meant to give you awareness. Because waking up at night is not always just about sleep. In many cases, it is your body's way of communicating changes that need attention. The heart does not always send dramatic warnings. Sometimes it speaks quietly, through patterns, through discomfort, through interruptions in your sleep. And if you listen early, you have the opportunity to act early. That is where control comes from. So here is one simple action you can take starting tonight. Pay attention. Notice why you wake up. Notice how your body feels when you lie down and when you sit up. That awareness alone can change how you respond. And if something feels different, do not ignore it. Address it early. Share this information with someone you care about, a parent, a spouse, a friend, because many people are experiencing these signs without understanding them. And if this helped you see your body differently, consider subscribing. Because the more you understand these early signals, the more you can protect your health, your independence, and your future. Take care of your body, and listen when it speaks quietly.